Welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us. In this segment, we're going to have a conversation with Dr. Emily Kraus. Dr. Kraus is joining us here as a pediatric sports medicine specialist at Stanford Children's Health and director of the Female Athletic Service and Translational Research Program, or the FASTR program. She's going to talk about how her team investigates fundamental physiological and sports performance questions that are important to improving the health and the performance of girls and women. Welcome to Health Professional Radio. Dr. Emily Kraus.
Neil, thank you so much for having me. This is so exciting, and I'm passionate about FASTR and my clinical work, so I'm excited to share a little bit about it with your listeners.
Well, tell us a bit about yourself and a bit about your work at Stanford Children's.
Yeah, so I am a sports medicine physician at Stanford Children's Health, as you mentioned, and I've been working there for, I'm starting to lose count, which is a little sad, but probably 5 or 6 years now. And I see athletes of all ages, and they come and present to me with overuse injuries and even some of the topics that we'll discuss related to the menstrual cycle, the female athlete triad, which I'll define later, relative energy deficiency in sport, which I'll define later. And I really work to try and get those athletes back as safely and as healthy as possible and back to their sport. And prior to that, I did my residency and fellowship training at Stanford. So I've been here for a while. And my residency was in a field called physical medicine and rehabilitation, or physiatry. And then I did a sports medicine fellowship for 1 year. And my particular interest and passions from both clinical and research revolve around bone health, the female athlete, and the prevention of overuse injuries. And so that really is a nice segue into a lot of the research that I'm doing now on female athletes within the FASTR program.
The FASTR program, Female Athlete Science and Translational Research Program. What is this program and why is it so relevant?
Yeah, so you spelled it out correctly. And so our FASTR program, it's fairly new. It's about 1.5 years old. And it's part of a bigger research initiative called the WUSI Human Performance Alliance. And so this is a collaborative partnership that involves 6 different institutions, and they're studying health and performance in athletes of all ages, starting with the basic science in the lab to that translational research. And really our focus is also on how to disseminate that information to athletes and coaches and parents and all members of that sports team and sports medicine and care team. And what our FASTR program is specifically, we're in close collaboration with one of the other institutions, the Harvard Female Athlete Program, under the guidance and leadership of Dr. Kate Ackerman. And so about 1.5 years ago, FASTR became a program, and I was chosen to direct that program. And so we built this team, and our focus is really trying to address the gender gap still present in a lot of research today. And unfortunately, if we look at how research is applied and translated to athletes, a lot of that original research is coming from studies on male athletes. And we're finding that female athletes are often underrepresented in a lot of different areas, from sports injuries and risk reduction to even exercise and performance research. So our focus is really to do the research, but then also translate that research well to the athletes through different types of educational tools.
What is it that we actually know about injuries, how they differ between men and women?
Yeah, the more we learn, the more that we do appreciate that there are differences in how injuries develop and present. And I think that's very important for a physician to understand, both with presenting traits and characteristics, but also how to manage that athlete, as well as ask different risk factor questions that could have led to that injury in the first place. And one particular injury that I do a lot of research on is bone stress injuries. So these are overuse injuries to bone from repetitive or kind of over a period of time, repetitive trauma. And it usually occurs on a spectrum from maybe a small bone stress injury, or what we call a stress reaction, to a full-on stress fracture. And that can be a season-ending injury for athletes. And we see higher rates of bone stress injuries in female athletes compared to male athletes. Another injury that we do see some differences in are ACL injuries, or anterior cruciate ligament injuries. And those, that's definitely a a concerning injury for athletes, because that's probably about a year out for that athlete, potentially more, to return to sport. And that could even be a sport-ending injury for some athletes, depending on where they are in their training. And we're seeing greater incidence of those ACL injuries, especially more of the non-traumatic, so that twisting injury in female athletes compared to male athletes. And then we're also seeing some differences in even just concussions and how concussions present from a symptomatic perspective, how concussions are managed, and all of that's really important to for a clinician to understand, so they maybe don't go into that clinic visit with an idea that they can manage that athlete in the same way. So it's really interesting to see some of those differences, and I think really understanding even some of those risk factors, which I'll get into kind of in some more definitions as far as female athletes, and some of the screening questions that we do in my clinic revolve around some of the information that we find and have found in our research.
You mentioned the female athlete triad. You said you'd explain that to us. What is it, and how does the FASTR program address it? Yes.
Okay. So the female athlete triad is defined as, so there are three interrelated components: low energy availability with or without an eating disorder, some degree of impaired bone health, a history of bone stress injury, or low bone mineral density, which can be presented or an individual can get studied through a DEXA scan to define that low or identify that low bone mineral density, and then menstrual irregularities. And so that's irregular periods or delayed periods in females. And so as our FASTR program, we're really looking to try to educate athletes on the female athlete triad and another similar phenomenon, relative energy deficiency in sport, which is an expansion of the female athlete triad. And we're seeing that low energy availability, which is this underfueling or overtraining or a combination of that, is really at the foundation of both. So we're really trying to target different nutrition interventions, nutrition education, and ensure that those athletes are fueling their body as well as possible for success. And so that's a primary focus, especially with some of our educational efforts.
What do you think is the biggest risk to a female athlete when she's injured?
I think really trying to understand the hormonal profile and the different hormonal milieu of the female athlete is really important to understand how to really quantify certain risks. So as an athlete goes through puberty, they go through a lot of different phases and stages of development, which involves a lot more and different types of sex hormones. And so with that becomes different risk factors, such as changes in ligament laxity, which could be a risk factor for ACL injury. And then we see also, especially with the lack of menstrual cycle, so a delay in period from underfueling, that those hormones are suppressed, and that can lead to impairments in overall bone turnover and bone health. So I think those are some of the different risk factors, especially early on, that we see that can have potentially both short-term and long-term consequences for that athlete's overall health.
Give us a website where our listeners can learn more, or if you have more than one web resource, we'd love to hear it.
Yeah, so you can find a lot of information on our FASTR website, fastr.stanford.edu, and FASTR is spelled FASTR. And then we also, fastr.su.domains is another way to navigate there. And then we also have an Instagram, Stanford FASTR, that we really push a lot of education for female athletes on a variety of different topics, from bone health to menstrual cycle to strength training.
Doctor, it's been a pleasure speaking with you. Thank you so much for joining us here on Health Professional Radio.
Thank you for having me, Neil.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Emily Kraus, pediatric sports medicine specialist at Stanford Children's Health and director of the Female Athletic Science and Translational Research Program, or the FASTR program. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.